Good day everyone, I'm Giselle Daniel from NU204 and today I'm going to perform the cleansing bed bath. So first, I'm going to wash my hands and introduce myself and explain the procedure to the client. So I'm going to wash my hands. And hello sir, good day. I'm Giselle, a student nurse from Asian College of Technology, and I'm going to perform cleansing bed bath, and I want your cooperation as well as that you don't have to worry because I'm going to provide privacy. So I'm going to close all the doors to avoid the client being anxious and for her to be more cooperative of the procedure. Now I'm going to place uh, a bath blanket on top of them, and I'm going to take away the top blanket, okay? The top blanket. So sir, ako niyo siyang paon. And then, and then, sir, kung kahion ka or kalibangon, pwede ra kang inundaan. Naapod tay bedpan, we have bedpan or urinal if kahion ka. Okay? And then, I'm going to assist for his oral care. So, sir, now, we already done our oral care a minute ago, an hour ago. So, I already assisted it. And then, I'm going to remove your gown, sir. Ako lang tantang, sir, ha? Okay. And then, I'm going to place a towel on under the patient's head. And, sir, put on the towel. Okay. And then, to the patient's chest. After putting the towel, I'm going to um, get the water. The water is a lukewarm, so I'm going to test if it's not too hot and not too cold for the patient. So I'm going to test it using my elbow. So it's not too hot and not too cold. So here, I'm going to do the miting. First, I'm going to do the miting. So I'm going to sponge the eye. So in sponging the eye, it's a different, sir, akong kakuha ng mata ha. From cleanest to the dirtiest. So this side, one, and the other side of the, and then after the eyes, I'm going to clean the face. So since it's gone, I'm going to do the other side. The face, so the face of the patient. And, after the face, on his ears, and behind his ears, and his ears, and behind his ears. So I'm going to wash it. And then I'm going to on his neck. On his neck. So I'm going to ask the patient if he wants a soap. So sir, ganahan ka magsabon? Dili ra? Okay. So in applying the soap, make sure that there are soaps that can make the skin really dry. So there are prescribed soap from the doctor. So it's to avoid the dryness of the skin. So after the nick, I'm going to proceed to, I'm going to dry it, rinse and then dry everything. Now I'm going to proceed on his arm. So I'm going to place the towel under his arm. So his arm, and I'm going to use another cloth for his arm. And then another for the drying his arm. So now I'm going to do the knitting. So it is for stroke downwards, and it must be paying attention on the axilla. So later on, I'm going to wipe his axilla, but I'm just wiping his arm. Okay, 1, 2. So as we notice, and then soak the arm of the patient. So I'm going to get another lukewarm water. I'm going to soak the arm of the patient. So I'm going to wipe his axilla. Okay. And after that, dry it. So do the same procedure on the other hand, and then I'm going to replace the water with a new water because it's no longer warm. And then I'm going to wipe, to rinse his, after the arm, after soaking the right arm, we'll proceed to the left arm. So soak it in the same procedure, and then wipe it and dry it. So after the left arm, and then we will proceed to the chest and the abdomen. So I'm going to drape the chest and the abdomen of the client, and then fold the table, the bed towel, and then I'm going to rinse with another cloth and a new water. I'm going to rinse, and then sir, trabaho ko yung chest and abdomen in a downward position. Okay, and then dry it, dry towel. After I'm done with his chest and his abdomen, I'm going to proceed on his back. So sir, Pwede ka magkakilid. Kamay. Kakilid kamay. Ano? Kilid. Okay. So, on his back, I'm going to sponge it and rinse it and then dry it. After that, I'm going to massage it with an alcohol. So it's good for his blood circulation. Massage is good for blood circulation and also for relaxation. Like that. So as usual, it's down and then down and then down. So after that, I'm going to dry it. So I'm going to use an alcohol. I'm going to use an alcohol to massage his back. So in massaging his back, it's in a circular motion, and also it's not too hard and not too. It depends on the client's wants, but it's not advisable to give a lot of pressure on massaging. So it's just for relaxing the clients. And after that, um, sir, balik na ka, sir. I'm going his lower extremities, the thigh and his legs. So, sir, I'm going to have the other leg. So, this one, I'm going to put the towel on it. And then, I'm going to, and first, be mindful enough to change the water if it's no longer warm. So at least okay. So from upper to lower, and then upper to lower, and then on the other side. From upper to lower, and then his feet. And also, dry it. And then, on his other side of the feet. So, let's proceed to the other side. Okay. So, in minding the body mechanics, to have, it's just bending the knees or getting the bed up, but I can't make the beds more higher because I don't have a higher bed. So that's just it. I just bend my knees or sit down. Easier. And then, after the bath, I already finished the bath. Okay. After I finish with the bath, I'm going to put a gown or kabisa and underwear to the client. And also, I'm going to apply a deodorant if he wants to. Ganun na kabutang deodorant, sir? Bilisan? Okay. So, I'm going to put a gown to the client. Kamisa or gown. So, sir, bilisan na dito, sir. Okay. The other hand. So, ilak lang ako sa likod, sir. Pilit lang, sir. Okay. Sir, ako lang po, sir, ha? And I'm going to remove the bed towel. So, I'm going to fold it quickly and put it in the Well, after the patients have his gown, I'm going to brush his hair, comb his hair, and um, clean and tidy the area, clean the area and return all the used articles, and then that's all. We all good, and thank you.